I am going to do some hip pelvic mobility exercises, because a lot of times I find that some people are really in tune with how to anteriorly or posteriorly tilt their pelvis, and other people give me the blank stare like, I have no idea what you're talking about, you crazy person. So a posterior tilt of the pelvis is when your glutes are tucked under. So this is scooped down, it's tucked under, and the anterior tilt would, an exaggerated anterior tilt would be when you're tipped forward, spilled forward. So we should be able to do either position easily, and there isn't a right or wrong. It's being able to control it and be able to do either on command, and not be stuck in one position all the time, because that's where the asymmetry and problems come in. So if you just get on all fours and practice just that itself. So we're gonna tip our hips down, so dropping our belly to the ground. This can get people tripped up. I'll even that. So you think, like you got Bruno here, when dogs are happy, they flip their tail up. When they are in fight or flight mode, they tend to tuck their tailbone down, posterior tilt. So anterior tilt, posterior tilt. And a lot of times, if we're not able to have good pelvic mobility, we'll cheat and we'll use our thoracic spine to create that posterior tilt. So a way to take the upper back out of it would be to use a chair, or I have a bench here. So I'm gonna put my chest on the bench, so it's my thoracic spine to create that motion I want to be happening at my pelvis. So I'm going to anterior tilt, it's much harder, and posterior tilt, anterior tilt, and posterior tilt. So it keeps you from cheating, and it forces that movement to happen at the pelvis. So it's small, it's hard to see, but I'm tipping the pelvis forward, and then I'm tucking it under. And this is a good exercise to do to get aware of the movement of the pelvis and help keep the joints lubricated. It's good for postpartum, it's good for pregnancy, it's good for anybody with a pelvis, which is everybody. So another way to get some feedback for that kind of movement is if you have a band, and then you would sit on your chair or band. You're going to draw the band right through the small of the back. So you're pulling on yourself. It's pulling you into that anterior tilt. So it's pulling you into the rocked forward. And you're going to draw the navel in and push into the band, bringing yourself into a posterior tilt. So you're going to let yourself fall into where the band is pulling you into the anterior tilt. Then you're going to draw the navel back, exhale the air, push into the band, and feel how that brings you into a posterior tilt. Let it pull you into the anterior tilt, exhale, draw it in, feel how it pulls you into the posterior tilt. So it's giving you feedback from a different aspect. And then that's all the front to back mobility for the pelvis. And we're going to do one more that is in a different plane of motion. So you're going to grab a yoga block. You're going to bring it under one knee. So you are in a hands underneath the shoulders, knees underneath the hips, but this hip is jacked up a little bit because it's on the block. So for this exercise, we're simply going to draw that knee up and level with the one on the block, and then let it shift down. So it's allowing the pelvis some asymmetry, and then you're using your muscles and your core to bring that foot up. The shin is hovered, and then let it drop down. This is a great one for pregnant patients that want to create some stability in their pelvis. This is great for people with SI joint problems. So you're just hovering, trying to get those knees parallel with one another. You're not trying to minimize the sway side to side. And if you have disc issues or some low back stuff, you can add a breath with it. So you're creating great intra-abdominal pressure with the breath. So if you really want to make it core focused, you'll inhale into the back, and then on the exhale, hover the knee, get all the air out, get every ounce of air out, and then lower down on the inhale, and then come back up on the exhale. So you do both sides. Deep breath in. Try to feel like you're breathing into your back, and then on the exhale, minimizing shift side to side. Hover those knees so they're in line with each other, and inhale that knee back down. Exhale, bring it up. So we're working on stabilizing the pelvis and getting a usable range of motion for it. So we've got the front to back motion with the anterior and posterior tilt, and then we've got some lateral movement with the block. So all good mobilization and stabilization for your pelvis. But don't do anything that feels sharp or painful. You should definitely get assessed if it feels sharp or anything like that. All right, let me know if you have any questions.